So my name is Dr Ebony Monson, and I am a Health and Medical Research Council Emerging Leader Fellow, and I work at the La Trobe Institute for Molecular Sciences at La Trobe University in the School of Agriculture, Biomedicine and Environment in the microbiology discipline. Yeah, I think it started, when I was a kid. I was really curious. I loved puzzles. I loved pulling things apart. And I really loved kind of understanding the underlying mechanisms of how things worked. And I guess as an adult, that curiosity never changed. And I think there's something really special about discovery, that moment when you're looking down the microscope and you realize you've seen something for the very first time, something that someone else has never seen before. I think that's incredibly cool. Yeah, so I think in the world right now, we have very good antiviral strategies, but quite often they're very targeted at specific types of viruses. And my project is trying to develop a novel antiviral therapeutic that's effective against multiple different viruses. So my work addresses this question by looking at our body's own immune responses. So these happen within minutes of infection, and we've been able to discover that tiny fat droplets inside our cells are actually key command centers for this immune response and drive immunity to virus infection. So this opens up a completely new way of thinking about how our immune response works. So I guess we've had three major breakthroughs in this project. So firstly, we've been able to show that lipid droplets are rapidly produced during viral infection, and this is actually required to mount an effective immune response. Secondly, we've been able to show that during this response, important immune proteins go to the lipid droplet and they act as a command center for driving this immunity. And thirdly, we've been able to synthetically make these lipid droplets and deliver them to cells. And we're able to show that these synthetic lipid droplets show very good antiviral immunity in our models. So billions of people around the world are infected with viruses every day, whether that be influenza virus, the recent COVID-19 pandemic. And this project has, a real possibility to change how we treat viral infections. Instead of developing antiviral therapeutics for each type of virus, this project is working on developing a pan-antiviral therapeutic. So that means that we can use our therapy across lots of different viral families, whether they're newly emerging viruses or whether they're mutating viruses. So in practical terms, this could mean faster treatments, this could mean better treatments for vulnerable populations and less severe infections. So more broadly, this work will help us future-proof against potential pandemics. So by understanding our responses to virus infections and being able to boost our immunity and help understand how our immune response is working, so then we can develop effective novel antiviral therapeutics for emerging viruses.